It was actually unrelated.
What was?
The heart attack and her weight.
It doesn't feel like we set shit up so people can be healthy.
Mm-hmm.
And that, to me, for a society that wants supposedly healthy people, seems so backwards. It doesn't feel that way.
They don't.
It's not just entirely individual choice. A huge part of it is, I agree. But another part of it is, like we talked, the societal factors that influence it. Right? We don't make being healthy the most easiest choice in a lot of places. We don't make walking an accessible tool in a lot of places in North America. We don't give people access to public transport that's effective for people to get around. You just tell people essentially like, yo, either you gym or you start running. Like in a lot of places in the world, a lot of people are healthy and they never go to the gym or run. You wonder why? Because walking is an option. Because taking public transport, natural forms of exercise that are very effective is an option. We don't also have a thing where our foods are just constantly laden with all kinds of things and preservatives that are going to make you more obese for no reason. It even affects people who are not obese and makes them unhealthier too. So we have foods in our industry that works actively against us to keep us from being healthy.
If you're poor, it's like they make legislation for you to eat crap.
When you're right, you're right. And in a recent video Abba and Preach did discussing the latest deaths occurring amongst the body positivity, fat acceptance advocates and influencers, they are right and called out a lot of why we as a society here in the United States especially are struggling with the obesity epidemic. We don't make health easy here in the States. The way our society is built is not conducive to everyone to be healthy. Walking is not really an option for a lot of people, and public transportation, while accessible in some areas, in rural spots of the United States, it's not feasible. Feeding yourself requires a lot of planning and forethought and access to transportation because so many things are so far away. The American culture is subsumed by the need of a vehicle because our cities have been purposely built to accommodate cars over people and public transportation. Many things in the States require a person to have a car, which is expensive and incurs many different costs. So when it comes to basic everyday movement of our bodies, Americans are not getting a steady amount of daily caloric expenditure that people in European countries experience, for example. I also want to note that for women, walking, public transportation, and personal safety is definitely a factor. But Abba is right. We don't make it easy for people to be healthy here in the States. And Preach is right too, that if you're poor, it's like they make legislation for you to eat crap. This all coincides with how our cities and towns are built and who benefits from those structures. Constructing towns and cities that have a copious amount of affordable fast food that for many people is the most affordable, cost-effective way to feed themselves and or their family, all of that benefits the big food lobby. Corporations like McDonald's, Burger King, Jack in the Box, Domino's, Dunkin' Donuts, Starbucks. These are large corporations that work hard in the political sphere to have the constructs of food requirements and safety work in their favor. And many of these food companies spend millions of dollars every single year conducting scientific studies to make food more addicting, putting more chemicals, colors, and preservatives in food to have you wanting more. And in some cases, like McDonald's, specific chemicals added to fries that activate specific centers in your brain. These corporations spend billions on marketing and advertising, as well as lobbying, so they don't have to change their practices. And because of their accessibility and affordability, which so many people are looking for these days, they make bank, and their customers are the ones that slowly suffer.
Societally speaking, I think we don't engineer things in a way that's thoughtful or considerate or engaging in practices that are most healthy for people.
I agree with Abba here. The reason why I agree, however, is because I see a much more nefarious connection between big food, politics, and big pharma. We are not guaranteed healthcare here in the United States because it is consumed by our capitalistic structure that is all about profits. I've said before that it's dangerous to have a healthcare system that is incentivized by profits rather than the health of the people using said system, because profits will take precedent over health. And that's where these three institutions, big food, big pharma, and politics, are all working together to keep us sick. Big food lobbies politicians to not change laws and regulations so they don't have to change their practices. Their food in turn, slowly but surely, makes people sick, which feeds into the big pharma complex. And big pharma is also captured in a multitude of ways, and that precipitates down to the doctors. Not all, but many that have been captured by our system because everything is about money here in the States.
Doctors, because they have, again, they're busy, they're going to be like, take the pill. You have this problem? Take the pill. Endometriosis? Take the pill. You have this? Pill. That?
Having doctors overburdened with patients and incentivized to prescribe pills rather than really work with patients and figure out what is wrong is a recipe for disaster, and is why the health of our nation is deteriorating so fast. There have also been some newer factors added in the last couple of years, but that's a different video. A lot of the American health issues comes from a lack of information, a lack of education, and a lack of access, and the oh so insidious propaganda around food.
No,
They
so
don't
many of the
want-
people in the food lobby just seem to be able to buy their way into the best spot to be advertising to our kids to eat the most sugar-laden food and convince them it's somehow healthy.
Hey, advertisement was crazy.
Yup.
The advertisement was crazy.
Yup.
Targeted to kids. Fruit roll-ups, fruit gushers, all the sweet stuff.
Yep.
When you go to the grocery store, where's the cereals? Boom, that level
Yep.
with the flashy collars and Toucan Sam,
Yep.
Captain Crunch, Count Chocula, all those characters that are man, this is weird.
Absolutely. The dark, dark propaganda of marketing to children so that they bug their parents so much they give in and get started at such a young age, getting addicted to a sugar high, something that our bodies are not built to have a large consumption of, but that at a young age is detrimental to physical, mental, and emotional health because sugar, just like caffeine, cigarettes, and other hard drugs, is a drug that's addicting. And when kids have so much of it, when it's filled with dyes and chemicals that our bodies are not meant to break down, it's again a recipe for disaster.
And the truth is, a lot of people's issues when it comes to their health are linked to their daily choices in regards to food and stuff like that.
While a lot of blame can and should be placed on big food, big pharma, and the politicians that are benefiting financially, both personally and professionally from those entities, working their magic to keep the status quo going, it cannot be denied that we as people are also making choices. Is it hard to find healthy, affordable food? Yes, but it's not absolute. I have personally shopped at the Dollar Tree, Grocery Outlet, Food Max, Food for Less, and Walmart for different foods. They might not be the best quality, but I want to have basics like simple veggies, fruits, proteins, dairy, and some canned food. I'm of course not saying that everyone can do this because there are a lot of factors like not having a vehicle, reliable transportation, limited income, etc. But that isn't the case for every single person. A lot of people do the fast food route because it's easy, it smells good, and convenience overshadows everything. I've also met a lot of people that have really no idea how to cook and how to grocery shop. A lot of people grew up eating like this, so of course it's going to be a difficult habit to get out of, and trying to learn a skill like cooking can be daunting for many. But at the end of the day, we do make our choices. We spend our money the way we spend our money. If you're on a limited income and spending money on things that are not for your shelter or food, but you want to eat healthy and be fit, it might be time to reconsider your financial priorities. This isn't to say you're not able to treat yourself sometimes, but it does come down to how you make your choices with your money. And unfortunately, none of this is easy. You can't just snap your fingers and have things miraculously work for you. It takes effort, it takes time, and it takes consistency. And if there's one trend I continue to see, especially in people that are in the body positivity movement, consistency is a difficult one. And for many people trying to lose weight, they can get seriously depressed when they don't see results as fast as they like, so they stop. I would also say self-control is a bit of a societal problem as well, which I think is part of the binge eating disorder aspect, but that's also a different video. The crux is, does our system make it difficult to be healthy and not really care about our health? Yes, which is why we have to put in the effort to plan, to research and strategize our food, our physical movement, our mental and spiritual health, because our system right now is not built to care about us. We are just a walking profit center for them.
I think it's a return of the balance because the health thing was so toxic at some point and using some crazy fucking tactics, and it was really crazy and really unhealthy that they went the other route. It's just the balance going on the other side, you know what I mean?
Yeah.
Diet culture in the States over the last 50 years has not been a healthy one. And the low-fat diets, soup diets, counting points, no sugar-added processed food diets, and a litany of dangerous detoxes, coupled with out-of-reach beauty standards pushed on kids, especially during the 90s, is a big part of why people are struggling today. We were essentially lied to because these big corporations wanted to make more money and keep us eating crappy food. I would argue that this is why the push for more and more social media control is so rampant, because a lot of people are sharing their weight loss stories that encompass them simply changing a few things in their diet, getting more movement, and it of course taking time. It's truly that simple. But the outliers, the 5% of people that have genetic impairments or disabilities that have real reasons for weight gain or difficulties with weight loss, are used by the majority for reasons as to why they can't lose weight, when none of those factors actually affect them. There's a lot of people that are frankly just using different excuses because it's easier to make an excuse than to sit down, take stock of your choices, have some accountability, and decide that enough is enough and it's time to take control of your life.
But we also have to acknowledge in society, some of our messaging around this stuff lacks compassion, lacks consideration, and it's generally just being like, oh, well, you ate it, you. And it's like, it's not that simple. And if you really think of creating society that way, then you're not really considering good solutions. You're not trying to create environments that are going to be conducive to you being successful.
Exactly. I agree that messaging around health and weight loss, as well as obesity, can be very caustic and hostile. We definitely need more compassion towards each other in general, and especially when someone is overweight, but taking steps to improve. Making fun of people in the gym or making comments about people's weight or what they're eating, those are not positive tactics that will instill in someone a desire to keep going. It's going to do the opposite. We have to celebrate the people that are trying, that are making the effort, that are going on that walk, that are lifting those weights and doing their damnedest. Because it's not easy, and we should be applauding and lifting each other up when we see that we are at the least trying.
If you have empathy for these people and you understand they're suffering, and many of them are trying to make a change, and they are making the change, it's just slow, or they're having setbacks often, the last thing that helps them is like you being there and being like, man, you die, but it's not helpful. You're doing that for your own ego and your own selfish desire to be like, yeah, that's what you deserve. But is that really an empathetic thing to do? Is that even kind or helpful to the people?
Couldn't say it better myself. So what do you think? We haven't really talked much on this channel about the body positivity movement, so it would be great to hear what y'all think. Do you have any plans for the new year? Is fitness and or health part of your New Year's resolutions? Let me know in the comments. And let's also please remember to be nice. Don't forget to like and subscribe. Thanks so much for watching. Stay safe, take care, and be kind to each other.